Hey guys, it's Ali here with the hardest. And today, let's talk about how to properly assess your ECG for ST segment changes. But first, a quick review. This right over here is called the PR segment. The PR segment begins at the end of the P wave and ends at the onset of the QRS complex. This over here is the ST segment. The ST segment begins at the end of the QRS complex and ends at the onset of the T wave. And over here, we have the TP segment. The TP segment begins at the end of the T wave and ends at the onset of the P wave of the next cardiac cycle. The TP segment represents the resting state of cardiac cells' action potential. And here is where we find our true isoelectric line. Whenever possible, the TP segment and not the PR segment should be used to assess for ST segment changes. The only exception to this rule are tachycardias in which the TP segment cannot be clearly defined. But remember, cardiac ischemic events, including STEMIs, are not commonly known to cause tachycardias. In fact, they cause the exact opposite. Now, let's look at some examples together. Here, looking at leads 2, 3, and AVF, if we were to compare our J point or ST segment to the PR segment or the beginning of the QRS complex, it would appear as though we have ST segment elevation. But let's draw a line through our TP segment and see where our actual isoelectric line is. And as we can see, once we compare the ST segment and J point to the TP segment, we find out that our ST segment is actually isoelectric and there is no ST segment elevation here. And here we have another example. Look at leads V5 and V6. If we compare our ST segment and our J point to the beginning of the QRS complex or the PR segment, it would appear as though we have ST segment elevation. But let's find our TP segment and find out if we truly have ST segment changes here. And once again, once we compare our ST segment and J point to the TP segment, we can see that there is no ST segment elevation here. And in fact, the ST segment and J point are isoelectric. How about this ECG here? Are there ST segment elevation in the inferior leads? Let's compare it to the TP segment and find out. And once again, as you can see, once we compare our J point and ST segment to the TP segment, we can see that there are no ST segment elevations here. And one last example. Take a look at this ECG over here. Do you see ST segment elevation or depression? Well, let's locate our TP segment and find out. What we have here is ST segment depression. Thank you so much for watching, guys. I'll see you next time.